Over the next few minutes, we're going to be talking about Medicare. And a lot of times people get Medicare and Medicaid mixed up. They are similar words, but they mean very different things. Medicare is a federal health insurance for people that are 65 and older and for some with disabilities. Medicaid covers medical costs for people who can't afford medical coverage. Anyone at any age can get Medicaid. So let's start with Medicare. Are you 65 years old or getting close? Once you hit that 65 number, you need to be signed up for Medicare. In fact, everyone has to sign up at 65 for Medicare, or they risk some really bad things happening. And we're going to talk about what those are. Catherine Sevier from AARP, Steve Edmonds from Alliance Insurance Services are with us. All right, so Catherine, let's start with you. When we say everyone has to sign up for Medicare at 65, a lot of people go, well, why?
Rules, and they're very strict. You have to sign up at 65. You can't do it at 64. You have to be 3 months before your 65th birthday to 3 months after or the month of. And if you don't sign up during that time, even if you have insurance, when you go to sign up later, you will be penalized, and that penalty will be tacked to your cost for the rest of your life.
Okay, did you hear that? That penalty is tacked onto you for the rest of your life. So let's put up the timeline so that it is very clear when you have to sign up for Medicare. All right, so you need to sign up the 3 months either before your 65th birthday, the month of your 65th birthday, or 3 months after your 65th birthday. That's, if you sign up within that sweet spot of time, then you are not going to be charged that extra fine and penalty. If you don't, that's when the fine and penalty comes into place. And Steve, when we talk about a fine and a penalty, and we say it's the rest of your life, are we talking about just like a percentage, or are we talking about some money that really adds up?
Well, it's two different penalties. So you have a Part B penalty, and that's 10% for every year that you went without coverage. And you also have a Part D, which is your prescription drug benefits. There's also a Part D penalty, and it's really complicated because it's like 1% for every month that you went without coverage. So if you go without coverage a full year, that's 12%. And just like Catherine said, the problem with these, if it was just for 1 year, that's not too bad, but these penalties last forever. So as long as you're on Medicare for the rest of your life, you will pay those penalties.
Yeah, and we're not going to be changing that because that's the government, the way that they set it up. And so this is what we have to abide by until they change it. And until this point, that is not changing. So, Catherine, to me, the sticking point for a lot of people is they're still working, or they have a spouse who is also still working. And when they ask their HR department, hey, do I need Medicare? The HR department says, no, you don't need Medicare. And so what kind of question should they be asking instead?
So they still need to sign up for Medicare. They can waive the reception of it if they have a credible insurance product that is provided from their employer, and they have to be able to prove that. So it's not that if their employer has a very high deductible that doesn't meet the criteria, they could be in trouble. So they need to understand whether or not they have credible coverage and then make the decision about whether or not they want to go ahead and go on to Medicare.
So when you say go on to Medicare, everybody has to sign up for Medicare. That doesn't mean that they have to use Medicare.
Correct.
Okay, so let's talk about this specifically. So, Steve, you touched on this just a little bit about Part B, as in boy, and we're going to put this up. Part B is actually using Medicare as your insurance. So, if you want to defer Part B because you have insurance through your employer, you actually have to defer this. You have to actually make a check mark somewhere.
Yeah, and you can just let Social Security know that you want to defer it. Most people, if they are still covered under their group health insurance through a job or even a spouse's job, you will still go ahead and sign up for Part A. The reason you will do that is Part A is absolutely free. If you've got enough working hours in your lifetime, and most people do, But Part A is free, so there's no reason to defer it. You might as well have it. Part B is the one you can defer. It's also the one that costs you $202 a month for most folks. So Social Security charges $202 a month and some change for that once it's activated. So if you have group health coverage, a lot of times people don't want to pay that extra $202 a month because they technically don't need it yet, and that's okay. You can do that. You can defer and then pick it up later whenever you do retire. But to Catherine's point earlier, you do have to prove that you had this credible coverage or you will get into problems later, and maybe not even be aware of it. So you really need to make sure that you have credible group coverage if you're going to defer Part B.
Okay, now people at home are asking this. How do I know, and what kind of steps do I have to go through? Do I have to just give them the name of my coverage? What do you usually have to do?
HR department, most employers, their HR department can tell you. All you have to do is ask them the question, is our insurance credible? Catherine mentioned a while ago, a lot of high deductible plans may not be credible coverage. You have to, the government has a template and they go by that when considering is coverage credible or not. Most of the time, if it's a big employer with over 20 employees, most of the time they do have credible coverage, but it's always safer to ask than to assume. So always ask your HR department. They can tell you in a second whether you have credible coverage or not.
All right, so hopefully that means that you know that you're crystal clear on the timeline, the 3 months before, the month, and then the 3 months after. Really quick, Catherine, can you talk a little bit about how Medicare is never going to call you and ask for your number?
Absolutely. That's the key. Medicare will never call and ask you for your number. They will, if they want to communicate with you, they will send you a letter or an email and you respond to them. So you're the person who calls back. So if someone dials your phone and says they're from Medicare, don't believe them.
Yep, then that is not how Medicare works. We appreciate your expertise for both of you. Thank you much. If this is someone this is something that you need to send to someone because they need to know about this timeline for sure. It's going to be in the Who Wants to Know section of our website. Right now, we're going to take a look at the forecast.